So you pick at every part of that video, except for the part that was justifying my use of these slurs and this attack on someone's looks, when my trauma was again denied, and which was not rightfully. I don't know the person. They don't know me. How the fuck do they have the audacity to even say that my shit was not, it didn't exist? Okay, I don't want to see kids in the trans community. It is a very dangerous and hypersexualized community that a lot of my friends are prostitutes. Or they're not that anymore, but they have engaged in that type of activity, which is not a safe sort of activity to engage in. Some people are built for it, I'm not. And that is one of my biggest reasons as to why I don't like to see transitioning children, because it is not safe for kids. When it comes to the medication aspect, if they are on puberty blockers, which I would assume they're on spironolactone at the very least, if you're male going to female, to block the testosterone. The side effects include fatigue, breast pain, dizziness, confusion, cramps, nausea, diarrhea, menstrual irregularities, if it was a female, obviously, kidney problems, abdominal pain, abnormal heart rhythm, difficulty with swallowing, erectile dysfunction, headache, hyperkalemia, which just means high levels of potassium, which essentially means tiredness, muscle weakness, numbness, nausea, or vomiting, blood in stools, blurred vision, dark urine, decreased libido, influenza-like illness. What? Hives, loss of appetite, rash, reduced need to pee. So this is saving a life. Ma'am, I am aware as well is that if they are on only puberty blockers, not actual synthetic hormones like estrogen or testosterone or estradiol or TES, if they were to stop at some given point in their teens, they could revert back to what they were normally supposed to go through in terms of just their normal pubescent era. However, if you are to cancel out your normal pubescent era, like you're just my normal puberty, you are going right into, you're a cash cow for Big Pharma, because you're going to have a whole slew of health complications further in your later adulthood because of the cancellation of your natural pubescent era. That's not safe to me. I'm sorry, but that doesn't make sense here. All because this child had a boy phase or tomboy phase or tomgirl phase, and they were kind of pushed or suggested that could be more than that. That could be something deeper. That could be something, oh, you're in the wrong body. Like, girl, be so for real. Now I'm going to take it a little personal and revert to an experience for myself from now being on hormones for about 10 years. I was detransitioning for about a year and a half, and I just got back on my hormone about a month ago. That year and a half was a very traumatizing year because of the fact that, like, the ups and downs of my mood and my anger was at an all-time high. Not to mention the hormonal acne that looked like a damn constellation on my back. It was extremely embarrassing and definitely very insecure inducing, if you will. And it was a point that I realized after I got on my hormone again, I was like, damn, I really have now subjugated myself to being dependent on big pharmaceuticals for the rest of my life. And that kind of realization, knowing that if there was a zombie apocalypse, God forbid, there wouldn't be estrogen or testosterone growing on trees. Like, I mean, I would have to find specific plants, I suppose, but at the same time, like, it just creates such a intense hormonal imbalance that just throws your whole body off, that, like, I just don't think is right for a child to decide to do for themselves for the rest of their fucking life, okay? Jesus. And don't even get me started on the shooting the blanks. Like, I can't even have no kids no more, which is a no problem. You get it, you don't get it. I doubt you get it, but it's okay. I love you anyways. I truly do, because I hope that you understand this